We're back here on the program, The Platform, and speaking with Dr. Sparkman Ferguson, who is my dentist, a good dentist. Dr. Sparkman, let me take this discussion to another level. There are some new things on the market that people are using for whitening of teeth in the Bahamas. Some people do this at home, and some people are actually going to dental offices to do so.
Correct.
Is it advisable to do it at home?
It is advisable to do it at home. There's no danger in whitening your own teeth at home.
Okay. All right. Now, there are people who are going to dental offices doing it. And there are some, I don't know what is being used, what chemicals are involved, but are there any hazards in doing so?
In the dental office?
Yes.
Yeah, there is, and precisely why it ought to be done in the dental office if it's going to be done professionally, because the difference between what you're able to do in your home and the dental office is the strength of the bleaching agent.
Okay.
Okay, so the bleaching agent is a very weak strength that you can buy in the drugstore. But when you're going to have this procedure now done professionally, the strength triples to quadruples. And then there comes the danger, because it can now burn the gums and damage all the pink tissues in your mouth. And that's where the professional needs to have his or her hands involved in it, so that we can protect those gums.
And you've seen this in your practice?
Seeing what?
The damage of gums as a result of bleaching?
I haven't seen it in my practice. I've seen it.
No, that people who would have done it elsewhere and came to you.
I have seen small bits of it before, yeah. Not, don't know where it was done, but it's a bleaching agent, and if it gets on the gums, it will burn it. It will burn it. Now, if you are doing it, even in our practices, we protect the gums with a barrier, a plastic barrier that we place on before the whitening is done, and if that gets a leak, you're gonna get the gums burned somewhere. Okay, and so even us who do it professionally, we could see a small white spot that said we burned something, but we're not going to have the whole mouth burnt up, if you get my meaning. Okay, because we actually know what we're doing with it.
Why do this in the first place? I mean, I understand some people want whiter teeth, but is that something that is necessary?
That depends on the person. It's a $10 billion industry.
10 billion?
In the United States, yeah. I hope I haven't overestimated that. But, this fad, it's a fad. And this fad is that, I need my teeth whiter. And many people run after it. It started, of course, with the Hollywood movie stars and blah, 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 like that. And then it, of course, like that, it passed down and then became a thing that every ordinary citizen wanted to do. All of a sudden, nobody was satisfied with how white their teeth were anymore, naturally. But I learned a long time ago that bleaching is for some people. It's not for everybody. If your teeth are already white, why will you need to bleach them?
The question is, how white is white?
How white is white, and it's one of the things we've got to talk with each patient about before we even start the procedure. What is your expectation? You expect it to be as white as a page in a book. You expect it to be as white as, what is white for you? But some people fortunately have white teeth already.
But isn't it true that over time your teeth would lose some of the whiteness based on age?
That is correct. As we age, our teeth begin to get a little darker tinge. Okay? And if individuals are not satisfied with that little darker tinge, they decide, okay, I need that bright tinge back, and that's what they do. Go ahead and have it whitened. These things are available for those who want to do them.
Yes. Let me ask you, isn't it true that in the main, most people do not attend their dentists regularly? And how, I mean, every 6 months, you should go at least twice a year, right?
At least, yes.
At least twice a year. And you would find that the vast majority of our population really do not pay any attention to that. Isn't that right?
That is true. That is true. For whatever the reasons are, that is true.
So dental hygiene is not high on the priority list of the vast majority of Bahamians?
In my opinion, it's not. It could be higher on the list.
And what are the consequences of this?
Well, if you do not look after the cleansing of the mouth on a regular basis, all of the debris that develop in the mouth continue to accumulate in the mouth and keep stuck to the teeth and just in between the gums and the teeth, that area. And the longer you stay away, the more it accumulates, and it accumulates to the point where it becomes a very thick and hard layer called dental calculus. So thick and hard that when we remove it, it leaves the gums bleeding. And so that is the beginning of what we call periodontal or gum disease, and that's the very disease we don't want people to have, and that's the reason why we push to have the regular cleanings every 6 months. So you don't have those debris sitting around the mouth doing nothing.
And many people have lost teeth due to this.
Correct. Most adults lose their teeth due to periodontal disease.
And so let me ask you, can you live to a ripe old age, 80, 90, with all of your teeth if you are attending your physician or your dentist regularly and cleaning professionally on a regular basis? Absolutely.
There are many, many persons around who can attest to that and who are living proof of it.
Mm-hmm. Those who you see who have lost a whole lot of teeth have been very careless with it?
That is somewhat safe to say. Some people are careless, and that has led to their disease process. And then some people, because of what they inherited genetically, and have this disease process add to it, cause eventually for them to lose their teeth.
Meaning, if you are diabetic.
For an example,
okay.
Yeah, if you're a diabetic and you didn't look after this thing very, very well, then your risk increases in losing your teeth.
Okay. So if you're diabetic, or if you are someone who has renal failure and all the rest of it, chances are you can lose teeth faster than people who are not?
Absolutely, if you're not having the regular care that you need to have.
Yes.
And conversely, once you actually have that care, that risk remains low, and you keep your teeth and gums healthy.
Even if you are diabetic?
Absolutely, even if you are.
Okay. Mm-hmm. What are the other medical challenges? I mentioned diabetes, but what are the other medical challenges that can cause the loosening of teeth?
Mostly, well actually, to answer your question in another way, the main reason why that happens is a local problem. It's local in the mouth, and that's what we've been talking about. Mm. That is responsible for almost upwards of 90% of the loss.
Or could it be the ineffective way that you brush your teeth? Some people brush teeth, mm-hmm. But do so
haphazardly.
Yes.
Mm-hmm. Yeah, but that's also a part of the equation. So when we talk about care, mm-hmm. The word that prefaces care is proper care.
Right.
And so if you're not brushing well, and if you don't floss daily, now I can tell you for a fact that most people do not floss daily. Even our best patients have a hard time flossing daily. Even though they come every 6 months, have their teeth professionally clean, they brush well daily, they will tell you that flossing thing really gets me every day. I can't remember to do that, or
yes.
I can't be bothered to do that, and so on and so forth. But if this package is going to be full, it's going to need the daily cleansing, which is going to be the brushing and the flossing.
And the flossing of teeth.
Every day.
Okay. There are a number of, if you go through the aisles of the food store and you see a range of products for of toothpastes and mouth washes and things such. I am given to understand, Dr. Ferguson, that the improper use of some of these mouth washes can also cause damage.
Yeah, that can happen. Some of them are very caustic substances. Every other week we've got to tell a patient of ours, well, you're using a particular product, you need to put some water in that and dilute it a little bit. Because the product is so harsh that it starts peeling the inside of the gums and peeling the inside of the cheek. It just peels right off.
Of your cheek?
Yeah, cheek, gums, any soft tissue in the mouth. And that's because the product is just very powerful for some. And if we see such an individual, we get them to dilute it or discontinue it altogether.
Okay, but you are suggesting it's advisable to dilute any mouthwash that you find, or that is not necessarily so? Not
necessarily so. Some people can take a mouthwash full strength without any problem at all. But if we note that it's actually peeling you, that's a cause for us to.
But you should know, the person should know without going to a dentist whether it's peeling, right?
Some people don't actually recognize it, that it's peeling. Yeah, it's possible. Most people we tell that they're peeling, they really did not know that.
Okay. Dr. Ferguson, I've seen young women in particular with rings in the tongue or pierced tongues. You would need to be a professional person to pierce your tongue. A professional person should pierce your tongue. Well, perhaps I should ask you whether or not your tongue should be pierced in the first place.
Yeah. My opinion is that your tongue shouldn't be pierced in the first place.
Okay.
And I can tell you without fear of any contradiction that no professional dentist would pierce somebody's tongue. So whenever you see somebody with a pierced tongue,
yes,
that's being done by somebody whose job is just to pierce body parts.
Okay. So if someone came to you and said, Dr. Ferguson, I want my tongue pierced. This is a fad. I want my tongue pierced. Now, what you going to charge me to pierce this tongue because I want my tongue pierced? What would you say?
I don't do that procedure. I wouldn't advise it, and I would sit down and actually try and talk that person out of doing that.
You would counsel that person against that?
Yes, very much, for many reasons. You can actually die having that done.
You can die?
Yeah. You can actually, in the worst scenario, cause your own death having your tongue pierced.
How?
Well, first of all, you're having somebody who has no knowledge of the anatomy of the tongue piercing it. That's the first thing. A tongue piercer. That's what they do. They pierce tongues, or they pierce ears, or they pierce navels, or they pierce wherever. Okay? I learned just today that there's a place in NASA that pierces anywhere you want pierced. Okay?
Your nose, your tongue, your ear.
Wherever you want pierced.
Yes.
I learned just today.
Okay.
They can pierce wherever it is.
Yes.
Okay? It's not limited to your face either.
Okay.
But so you have an individual who's going to pierce your tongue, who probably doesn't know anything about it. We as dentists, when we work, we try not to touch the tongue at any time. Tongue bleeds, okay? And the tongue has very large blood vessels in it. Now, just imagine somebody who has no knowledge of the tongue, piercing the tongue, and then pierces right into the main artery of the tongue. The mouth starts bleeding. It fills up with blood. You can't stop it from bleeding. The tongue starts swelling. The tongue swells so much that it closes off the back of your throat, and what? Can't breathe.
Okay.
That's reason not enough not to even consider such a terrible thing to do.
Okay. Talking about the tongue, the cleansing of the tongue is extremely important.
Absolutely.
Good. Advise, how do you go about cleaning your tongue?
Yeah. There are a couple of ways. First of all, your regular toothbrush with toothpaste, with a circular motion or any motion that's comfortable for you, can just brush on the entire surface of the tongue. Okay, I would say for a minute or so, every time you brush, and that will cleanse the tongue because the tongue, once it needs to be cleaned, it's coated. It has a coating on it, like a white coating, a whitish yellow coating on it, and your job is to actually brush it until you don't see that white coat anymore. Then you know you've actually done that. And then as of late, we've got tongue scrapers, which some people like also better, which they take these instruments, which are plastic, and they scrape the coating off first, and then come after that with the toothbrush and toothpaste and actually cleanse the tongue with the toothbrush.
And this should be done every time you brush?
Every time you brush.
Not the scraping, though?
If you can tolerate that, you can do it each time. It doesn't hurt.
Okay.
Yeah. And the reason is obvious why the tongue has to be cleansed. It carries almost all of the bad breath that someone would have.
It is...
it's responsible for almost all of the bad breath when someone has bad breath.
I thought the tartar built up in around the tooth or your teeth will cause that as well.
That would be responsible for some of it also. But we talk about what will cause the most of it would be a tongue that has this coating over it that's sitting there just filled with bacteria and smelly.
Mm-hmm. Okay. Dentists should advise their patients about all of these things that you're talking about on an ongoing basis, right? When they if they regularly visit the dentist. Do you find that people are inquisitive about oral health when they visit you?
Not as much as I'd like them to be.
Okay.
I always tell patients, you go to the doctor, you spend money, ask questions. But I find that my personal feeling is that I could take more questions, many, many more. And patients just need to ask them. They
come for a particular routine and that's it, eh?
Yeah.
Okay. Mm-hmm. Now, extractions, let's go back there. Mm-hmm. Because some people believe that extractions ought to be the ultimate or the final thing that you do. And that you should try to save a tooth as much as possible. Is that your advice as well?
It's still the standard.
Okay.
It's still the standard. The standard is at the end of the day, all your natural teeth had to be present.
Well, back in the day, you had the old dentists who, once you had a cavity, they pull it. Huh?
I wasn't here back in the day, but
yeah, man, you were right here.
My feeling whenever I hear of that, I'm thinking a couple of things. The number one thought being that when such individuals arrived at the dentist, the cavity was too big to be saved.
Too far gone.
Yeah, and that's why most of the time, and it still happens today.
Mm-hmm.
Persons wait until a cavity is very large and the tooth becomes painful. Now it's time for treatment. Now they want a filling done,
mm-hmm.
but it's too late for a filling.
Okay.
And so back 20, 30, 40 years ago, the choice of treatment was to remove the tooth. In today's dentistry, you can have root canal treatment as a last resort to save the tooth.
And root canal, root canal is extremely painful and expensive, I'm told.
The pain is the expense, yes.
Okay, all right. Let's take a break here. We're talking dentistry on the platform this evening with Dr. Sparkman Ferguson, the Registrar of the Bahamas Dental Council. And perhaps we should talk about the technological advances in dentistry when we return. We'll come right back.